Hi, my name is Bianca Mayzel, and I'm in the Science Internship Program for Nursing. I will be attending Mayfield High School in the fall as a senior, and I worked at Euclid Hospital, and my project was on nursing compliance with Foley catheter securement devices. A Foley catheter is an indwelling catheter, meaning it stays in the bladder for an extended period of time or for over 24 hours. And because the bladder is sterile, it is vital that the insertion of the catheter be a sterile procedure. It is also important that the catheter be well maintained. If sterility is not maintained, a CAUTI may occur. A CAUTI stands for a catheter-associated urinary tract infection. It can be caused by many things, but with a catheter, it is mainly caused by the movement of the tube inside of the bladder and the urethra. One of the many ways to reduce the rate of a CAUTI is a securement device, and at Euclid, we have implemented the use of a Foley anchor securement device. The device is strapped onto the catheter and then onto the leg. It firmly holds the catheter in place, making sure that the catheter does not move around the bladder and cause an infection. My hypothesis was that monitoring nursing compliance with Foley catheter securement devices and educating nurses about the importance of the device will increase the usage of the Foley catheter securement device while decreasing the amount of CAUTI. My methodology was as follows. Before rounding on patients, we sent out 350 surveys to floor nurses to see what nurses thought about the Foley catheter securement device. 71 surveys were received. The results of 2 questions are showed in the results section. While rounding on the patients, we used a tool called a NOM, or Nursing Operation Manager Report. This report told us what patients had Foley catheters in the hospital. Every day we would check these patients to see if they had a securement device. If a patient had a securement device, I would mark yes on our data sheet and then look to see if they were applied correctly and if they were dated and timed. If a patient did not have one, I would mark no, find the nurse, and give them a securement device. I would also explain the importance of one and ask the nurse to put one on their patient. We collected this data for 25 days on 333 patients. At the end of the data collection process, I entered my data into a table. This data is for the percentage of patients with securement devices and percentage that are appropriately placed. The light purple shows the percent with securement devices, while the dark purple shows the appropriate placement. This is a question from the survey, and it answers how often do you use a securement device. This graph shows that over 75% of nurses use securement devices always, usually, or sometimes. This question answers, do you think a securement device is useful? As seen from the graph, over 50% of the nurses believe that securement devices are always or usually helpful, and only 1% found that they were never useful. My conclusions are that after rounding on the first day, 25 out of 50, or 50%, had securement devices that were properly placed. After providing an educational in-services and rounding for 5 weeks, the compliance rate increased by 26%. I also found that the nursing staff verbalized more understanding of the securement device and its importance. My recommendations would be that this study be continued on a larger patient population. This way, the results will be more accurate. There should also be more educational pieces presented to nurses about Foley catheters and the securement device. The same survey should be sent out after the study is completed to see if nurses' opinions have changed and to validate the findings. I would like to thank my mentor, Vicki Gardner, and my co-mentor, Chris Tusach, for helping me complete this project. I would also like to thank the Office of Civic Education Initiatives for choosing me for this internship.